You're listening to a brief excerpt on how payers can close costly gaps in care, co-sponsored by LexisNexis Risk Solutions. During this webinar, Doug DeShazo, Director of Interoperability Healthcare with LexisNexis Risk Solutions, shares insights on leveraging claims and clinical history to inform potential care gaps that can be closed to improve HEDIS and STAR ratings and non-HEDIS measures.
So what we're going to briefly go over today is how we leverage claims and clinical history to inform potential care gaps that can be closed to improve HEDIS and STAR ratings and even non-HEDIS measures. Understanding how Da Vinci DEQM, or Data Exchange for Quality measures, can be used for gaps in care reporting and those use cases. How we might use the new FHIR standard from HL7 to report those gaps in cares. The different models, push versus bidirectional, and how we use gaps in care intermediaries and partnerships, particularly to maybe calculate those gaps in cares and the data sets in which we want to access in order to do so. So here we have just a slight list of some of the numbers that we're dealing with gaps in care over the last year or so. So we have 18% of rising risk patients move into a more expensive high risk category. Gaps in care obviously have a significant impact on the quality ratings for payers such as HEDIS and STAR, and Medicare reimbursements are affected by quality measures.
You've been listening to a brief excerpt from the How Payers Can Close Costly Gaps in Care webinar presentation. This webinar was co-sponsored by LexisNexis Risk Solutions and recorded on December 8, 2021. The full 30-minute webinar included an interactive speaker presentation with audience Q&A. You can watch the full webinar video by going to the link that appears now on your screen.